We're going to bring you now the latest on the winter pressures facing the NHS, and we've got some more insight today into just how much strain it is under. NHS England has released some new statistics revealing what's going on in hospitals just last week. Have a look at some of these. It showed there were more than 5,100 patients with flu in general and acute hospital beds. That's an increase of 47% compared to the previous week, and that is up a staggering 13,000% on this time last year, although we should say the fallout of COVID restrictions meant there was a lot less flu around 12 months ago. Ambulance handovers, that's the big one. Delays climbed to a new high, with more than a quarter of patients waiting over an hour to get into A&E. And why is this? Well, the latest data shows some 93% of beds have got people in them. And perhaps frustratingly for doctors, almost 13,000 beds a day are being taken up by patients considered medically fit enough to actually be discharged. Well, our political editor, Andy Bell, has been speaking to a paramedic about what it's like for them and the family of a patient who waited 18 hours for an ambulance.
Mum was struggling to breathe after contracting this flu-y cold virus. She was turning a nice blue colour. I held the phone under her mouth so that the dispatch person could actually hear that she was really struggling to get the ambulance to us quicker.
On Monday, Louise Walters went with her mum Susan to hospital, but when they arrived there, it was 18 hours before they could get out of the ambulance.
The waiting times are ridiculous. People are dying. While we were waiting in the queue outside, we witnessed on two separate occasions people driving up in their cars into the ambulance bays with their hands on the horn, and one of them was a very unwell lady having a stroke and the other one was a young boy fitting.
That is echoed by the experience of this paramedic in Birmingham.
We're on the back of the ambulance for in excess of kind of 9-10 hours with one individual patient, monitoring them and kind of keeping an eye on them regularly. It can be quite daunting.
Dr. Sarah Whiteman looks after integrated health and social care in much of Bedfordshire. She told us she did have contingency plans for army-style field hospitals.
Whilst that might be an option, they're not imminent. At the moment, we're coping. We've had a really difficult 2 weeks, but things hopefully will begin to improve.
The fact that you're even considering it, does that tell you this is worse than it's ever been?
I think so.
Today, the Prime Minister was touring a London school, but it's on health that he must deliver some good results.
People should rest assured, one of my promises that I made this week was to tackle NHS waits, and I'm fully committed to doing that. We're putting the extra money in, and we need to make sure that the initiatives that we've put in place actually make a difference, but this is what I'm focused on.
Louise Walters' mum is now back home, recovering, but still sick. The family has only praise for the staff they met, but like many, they worry whether the NHS is going to cope.
Well, Andy joins us from outside Westminster tonight. And Andy, of course, all the pressure we're talking about on the NHS is added to by the strikes. I don't know if you've just heard, but there's just been some news drop that there's another ambulance strike taking place on the 23rd of January. Is there any movement on those strikes, and what might happen with those?
Well, Dan, all government departments involved in strikes have written to the unions they're dealing with, inviting them to meetings as soon as possible, and that includes the Department of Health. But I understand from Department of Health sources that any talks are not going to include opening up the current pay settlement. What could be talked about is how we arrive at the next pay settlement, and when that process is concluded at some point later in the year, what is agreed there could be backdated to this coming April. So the idea is that presumably there'll be a more generous pay settlement on the way if people are prepared to wait till April. So some sort of offer, I guess, but the fact is most of the people on strike within the health service at the moment want the current pay deal renegotiated, and the Department of Health, the government is saying that is not going to happen for now. So perhaps some sort of talks next week, but maybe we shouldn't get too carried away yet.